Hi, everyone. This is Dr. Eric Hazzard, and I'm excited to share a little bit about social determinants of health data and how that can help inform community needs assessments. A little bit about myself. My background is in the academic side. I have a PhD in nutritional biology at UC Davis and spent about half my career doing research and evaluation for health and human services organizations, as well as nonprofits, and spent the other half in health tech industry. I'm really excited to share a little bit around social determinants of health data and how that's impacting and challenging the ways we think about community health needs assessments. As we all know, community health needs assessments are really crucial and important for both public health and community health, and we know they've been around for a while. They've been a valuable tool and a really a valuable process for decades. So completing a community health needs assessment can really lead to important insights about the clinical and social health of communities. As you all might know, that really they've been going on for a long while, though the ACA and some other policies required CHNAs or community health needs assessments to be made mandatory for tax exempt health systems. So each system had to conduct one every 3 years and create an implementation plan to start addressing the needs of the community. Really, CHNAs require a community approach and really a multi-sector one. And it has to really go and represent the community, and it really has to be able to address the aims, which is to actually start solving the needs of the community. So the ultimate goal of a community health assessment is to develop strategies to address community health needs and identified issues. So a variety of tools and processes may be used to conduct a CHNA. The essential ingredients, though, are community engagement and collaboration and participation. And we can really see here that you have to focus and do a lot of different steps along the way. So completing or undertaking a CHNA, it's really a major endeavor. And while one can build on the previous needs assessment, these steps are critical. CHNAs generally take at least 6 months and sometimes closer to a year. If you think engaging the community, collecting the data and analyzing the data, then one has to then select the priority health issues and then continue to document, create the plan, and start to evaluate progress. Well, I think it's an interesting time to take a look at how do we think about new sources of data and new things going on in communities around social determinants of health. So with the advent of social care referral platforms, new ways of collecting data, both the supply, what communities are needing, and the demand, the status of the ability of the community to meet those needs, really now exists in a way it hasn't before. And that's because there are closed loop referral platforms that are capturing the ongoing needs of individuals within the community, real core needs, and the ability for the community to address those needs. So we can look at something like this flow where an individual is screened, their social determinants of health and needs are identified, they're sent referrals to all the community partners in this network, and then the community is then able to either resolve or not to resolve and then track the outcomes. And in this sense, this is really critical and really different because what we're able to achieve is better quality data about the ongoing needs of the community, and it's near real time. So the opportunity to have insights is not delayed 6 months or 1 year out. You can, in fact, be currently looking at what's going on in the community. And really, at the end of the day, a community health needs assessment is not just about getting data, it's about understanding what does one do. If you have the information, what can you do that's actionable? So as you can see on this slide, this data can then lead to guiding folks to reinvest in certain strategies in certain areas within the community. So again, with these closed loop referral platforms that are capturing outcomes, it's critical because it gives the information that folks need, which is one, the supply. Who and what do folks need in terms of supports? Two, are the community able to meet those needs? Are there the right CBOs? Are they able to provide the right sort of services? And three, what are those resolutions? What are those outcomes? And with that data, and with the ability to engage these closed loop referral platforms and these different organizations providing them, it's really impactful to be able to get this data, start to think about, well, great, how do I take steps forward to meet the needs, to change the way that healthcare dollars are spent, to help shift them into social care dollars? Because at the end of the day, a community health needs assessment is just that, an assessment. But we have to continue to take steps to better understand the community's needs and start to address them. And so when we think about new ways of data, I think we can look towards platforms, data collections, and methodologies that are looking at near real-time data, that are looking at what's really coming out of the community and start to create mechanisms and ways to take that data and start to make actionable changes. And as one continues to utilize platforms like this, you can continue to evaluate and see what's going on day after day, week after week, month after month, as well as have apples and apples to compare, not just apples and oranges. So I really do think this is a unique and interesting way to think about community health needs assessments, not just every 3 years, but really look at this as an opportunity to engage in community health every step of the way, month after month and year after year. So thank you so much. Please let me know if you'd like to reach out. Here's my contact information, and I appreciate this opportunity to connect with you all.